Okay, so good. I think it's almost afternoon. Good afternoon, everybody. And this is going to be a little different talk from what you all have been hearing since morning. So let's move ahead. I sincerely thank the organizers, Dr. Bansi Sabu, Dr. Shashank Joshi, for inviting me here, and feel very fortunate to be among you all today. Okay, so today I'll be discussing a few things related to a role of exercise and yoga in management of diabetes. I'll be covering the key points like today's lifestyle, stress, benefits of exercise and yoga, supporting studies, some asanas, yogic postures, and the summary. So how is it today? You can have a look at this picture. High stress levels, frustrations, not just sedentary lifestyle, but even faulty lifestyles, faulty food habits have increased the incidence of diabetes by many folds. Stress can be defined as physical, mental, and emotional strain on an individual, and all the above factors I spoke can have a negative effect on health in number of ways. You must be experiencing stress at every moment of your daily routine, and especially I have emphasized more on stress because nowadays we see that most of the diseases are psychosomatic, stress related. Then whether you are suffering from peptic ulcer or you are having joint pains, the moment you are stressed out, you have hypertension. The moment you are stressed, those weak areas of the body get severely affected. So what does it do? Your brain, you are stressed out, headaches, feelings of despair, and you can just see memory problems, trouble sleeping, mental health problems. You have skin, muscle and joints. Let's go to the heart, your stomach pain, heartburn, weight gain. Let's skip next, intestines, diarrhea, constipation, all are related to stress. And let's not forget that here, increased risk of diabetes, which is what we are here today to discuss that in specific. So, experience of stress is associated with the release of counter-regulatory hormones, including cortisol and energy mobilization. Cortisol counteracts with insulin and causes enhanced glucose production by hepatic gluconeogenesis and by inhibiting the peripheral utilization of glucose. This I need not mention, you are all well versed with this, and contributing to development of entire spectrum of metabolic syndrome, including insulin resistance and dyslipidemia. So here, blood pressure, sugar levels, lowers immunity to fight disease. Now this is a very important thing, like you really feel your immunity system crashing down when you are stressed out. And of course, obesity. It comes as a complement with all these stress. So risk factors, let's talk about risk factors associated with diabetes, type 2 diabetes. Prospective studies have shown that type 2 diabetes increases the risk of microvascular complications such as retinopathy, nephropathy. Nevertheless, most diabetic patients die of microvascular complications, including coronary diseases and stroke. Cardiovascular risk factors are increased 2 to 4-fold. Now, if you look at all this, won't it be don't we need to give a thought at this juncture how we can help reverse these situations, improve these situations? Perilous nature of this disease provides irrational for searching for therapies other than pharmacological measures that help reverse these grave consequences of diabetes. Impact of exercise in yoga in euglycemic is well established. So let me just know how many of y'all exercise daily or have a small session of yoga in the morning, pranayama, meditation. Great. Okay. Very few hands. I'm sure everybody is very busy. Okay, that's good. So, subsequently, the role of exercise in yoga is much amplified in diabetes. Regular exercise programs, asana, pranayam, meditation are not only effective in increased insulin sensitivity and better glycemic control, but also have been proved efficient in culminating the risk of overt diabetes in individuals who have been documented to have impaired glucose tolerance. Now let's look at what our ancient sages and Maharishis had to say. We should be very proud to be Indians and know that along with the modern technology and research so much advanced, we have certain statements made by these rishis way back 2,000 to 3,000 years ago. It was in Atharva Ved that a small section of Ayurveda is mentioned. Importance of exercise and yoga dates back to ancient time. So the slok is Vyayame Roge Vaividhya Praga Rude Veternas Snanam Jala Avasekaha Sevatta Vegle Geru Chandanaha Ra Vilepanascha Na Santi Meha. Meha means Madhumeha or Prameha, it is the term used in Ayurveda. So Charak Samhita Dvitiya Bhag, that is volume 2, 6th Adhyaya and 15th Shlok, has mentioned very much ki Vividaha that various type of exercises, that time walking and running and all, and asanas. The beauty of how those rishis, Patanjali Rishi, they never had how to name an asana. So they used to look at a tree and talasana. There's any Garudasana. They used to look at the bird and name it as Garudasana, Bhujangasana. So that is how they use those things, and things with the terminology was maintained. So it's a real interesting thing to look back into our scriptures and see what we can, how did they know that exercise was useful then also. So proven trials supporting the benefit of exercise in diabetes. Yes, of course, I'm sure most of you must be knowing that the American Diabetic Association's clinical practice recommendations 2002 say that possible benefits of exercise is substantial in diabetes. The American College of Sports Medicine says that physical activity, including appropriate endurance and resistance training, is a major therapeutic modality for type 2 diabetes. And this was a very interesting study I came across by Kerry J. Stewart at exercise training and cardiovascular consequences of type 2 diabetes and hypertension comment that benefits of exercise training go beyond the recognized benefits of glycemic control and blood pressure reduction. Similarly, if you see a few of very popular studies conducted on benefits of yoga by role of yoga in diabetes by Dr. B.K. Sahai confirms that control of diabetes mellitus, drug dosage requirement was reduced, acute complications significantly reduced, there were marked changes in insulin kinetics and those of counter-regulatory hormones like cortisol, increase in lean body mass and decrease in body fat percentage, improved insulin sensitivity and decrease in insulin resistance. Similarly, yogic practice and diabetes mellitus in geriatric patients, the study conducted said that regular practice of yoga establishes natural harmony and functional balance between organ systems, strengthens and increases muscle tones and helps conscious control over autonomic functions of the body. Studies have also, we had done a small study on young adolescents with PCOD and obesity. They showed significant results with regular practice of asanas over a period of 9 months, proved beneficial on overall well-being and showed regularity in menstrual cycles. Studies also reflected increase in muscle mass, decrease in body fat percentage. These changes in body composition mediate improvements in insulin sensitivity and endothelial vasodilator function. This was a girl, Neeta Pandya, she's 13 years, and you can see how in this slide her baseline study was almost 430 insulin resistance, and after 9 months it almost came down. This was a very classic example which showed that how exercise, and here my role was to teach them Surya Namaskar and Pranayam and Chaitanya Asana, that is Shavasana. And we got excellent results in these young girls in the 12th and 10th standard who are just confined to their desk and studies and no physical activity. This is another girl, I could not put her slide, this also was very interesting. If you can see how acanthosis nigricans and hirsutism she was in 10th, about to appear, this was somewhere in November 2006. And now she's in the hospitality world. She's as a front desk receptionist and doing wonderful. And I can't believe it is the same girl. So these are the benefits what exercise and yoga can do to reverse these impaired glucose tolerance to a normal person. So yogic postures, a few yogic postures which have been beneficial effect in patients with diabetes mellitus. Specifically, these postures are more concentrating on the core of your abdomen and plus on your large muscle groups where you can activate your insulin sensitivity. Now here Parvatasana is a very classic this thing. I have a better slide. Ustrasana. One thing I would like to say, whenever, even if you all practice yoga, just be careful about the complications you'll have like hypertension. Even moderate to mild hypertension, I make them do all the postures under my supervision, but severe and cardiac problem people with low back pain, and these are the simple things which you all should really understand and be careful in selecting your exercise pattern for your patients. Ustrasana is very good. It gives a very nice stretch to the abdomen, your back muscles, your shoulder, and is very well stretched out. It really helps. This is a very important asana to be practiced in for diabetic people. It's Ardha Matsyendra Asana, and this gives a very nice twist. Now one thing is very important, you all must take it into consideration. I won't be talking much about exercise because I think we all know the norms of FIT, that is FITT, frequency, intensity, time and duration, and how your maximum heart rate should be monitored in selecting exercises. But in yoga, you may first just spend a week or so in practicing the normal postures, coming to the optimum position, and then waiting in that posture for 2 minutes is more important. It should kind of complete a complete circulation, one complete blood circulation. Konasana is also very nice in diabetes. These are some which I really select according to disease wise. Yes, this is Parvatasana. It's got 4 variation, and this posture, it should be a little more bending down so that your stomach is pulled in and your hand should come parallel to the ground, your head should be in and your hand should be up. It's something like this. You should be in that's not the right picture. And plus these are the variations. They are tremendous help in diabetes. Now I have picked up this slide in all because there are few things which are very good here. You should be careful. Of course, the elderly group people should be you should select the asana. This is a very beautiful, very dynamic. Now you all should also understand what is the meaning of dynamic. I'm sure most of you must be doing yoga also. Dynamic is more which involves the large muscle groups in the body, and meditative asanas, though we say ki, oh, there is nothing much in the meditative poses, but let me tell you, if you have to sit in meditation, let's say in Padmasana, or in even in Vajrasana, being careful about the knee problem, even if you have to sit for 10 or 15 minutes in this asana, it's very difficult because you're controlling your physical and mental, you're making a coordination between these two aspects. So in fact it is even more tougher, but their effects are profound. And quickly, if we go through these are very good. You have to just be in the young group. You can give these exercises for diabetics. And Dhanurvakrasana is good. This is very good. And yeah. So these are a few of them which you have to be very careful in selecting. Now, I didn't want to take this, but the only beautiful thing I have noticed is this is Bhadrasana. It is again a very beautiful pose. The strain it comes on your internal thigh muscles, and you have to give a butterfly stroke, and then slowly you have to bring your elbows to the ground and putting your head to the toes. It's a beautiful asana, very relaxing. It calms your mind and body. And of course, Setu Bandhasana is also very effective in diabetes. Again, this is a fantastic Surya Namaskar. There are 12 postures, and the beauty is if you can master this skill of not touching the abdomen to the ground throughout the exercise, is you should say that you have achieved the mastery in this asana. And the best part of Surya Namaskar is you can even do it as a warm-up. If you do quick repetitions, say 6 Surya Namaskar, and then go with counting of 6 to 8 counts in every posture, that is a slow version, is more effective. And especially when you are here, this is kind of a plank. This, if you can maintain each position 2 minutes, it's kind of resistance training, your flexibility, stretchability. It improves your mental, spiritual and physical strength. Yoni Mudra is very good. We are connected with the outside world through our 5 sense organs, or the
time is over, madam.
Yeah, that is your Dhyanendriyas. So cutting yourself from the outside world it really cools your body. Virasana, this is again, it looks very simple, but it's a very difficult. And Chaitanya Asana. Chaitanya Asana is Shavasana also. This has profound calming effect. Now when we talk about asanas, it's not like we should do asana, pranayam, dhyan, dharana all separately. It has to be all together. Pranayam, you should do it along with the asanas. So let's sum it up. Regular practice of yam, niyam, asana, pranayam, pratyahar, dhyan, dharana and samadhi. Gentle relaxation and contractions exerted while doing the asana have direct influence on secretions and optimum functions of the organ as well as of the endocrine glands. Dynamic yoga, meditative yoga along with pranayam improve your mental, physical and spiritual being. This is something I just want to highlight, that cell-mediated immunity is defective in patients with type 2 diabetes, particularly with poor glycemic control. The defective cell-mediated immunity predisposes the diabetics to various infections, acute infections. Yogic practice have favorable effect on the lymphocyte migration test and suggesting an improvement in cell-mediated immunity. Similarly, I just want to highlight again pranayam shavasana, that is Chaitanya pose, is documented to produce an intense calming effect on the mind and is responsible to relieve psychological stress. Why we are talking about stress here? Because diabetes is really related with stress. I have seen my patients, no history of diabetes, very organized food pattern and diet pattern, but still young adults are coming up with detected diabetics. Catecholamines are secreted after stimulation of sympathetic nervous impulse, which regulate diverse physiological functions in the body like release of glucose, lipids, constriction of blood vessels, increase in blood pressure, heart rate and increase in BMR. These practices have a calming effect on your hypothalamus, pituitary axis, adrenal axis, and able to calm the stress busters. There is a very nice quote I want to say, Chinta and Chitta. What is the difference between चिंता and चिता? चिता तो मरे हुए को जलाती है, चिंता तो जीने को जलाती है. So that is how we can relate stress. how much intense effect it can have on our psychological and physiological functions of the body. So pranayama and shavasana. If the chairperson allows me 1 minute, if we can just do a small exercise, if you can just close your eyes and just listen to what I'm saying, just close your eyes. Just concentrate on your breath. See the cool air going in. Don't open your eyes. See the warm air coming out. Feel yourself. Center your thoughts. Center your mind. Feel the circulation energizing each and every part of your body. See the blood flow going to the toes. See the blood flow going to the left toe. Center your thoughts. Relax your mind. Relax your body. Slowly energize your heart. Energize your body. Feel the gentle breeze. Can you imagine how beautiful it is if you have a small balcony overlooking your lovely garden on a spring morning and you see the freshly watered garden, the gentle breeze, the lovely fragrance of the flowers, and you are doing your little yoga practice and you're so close to nature. Just go home and see the experience, feel the experience. When you come closer to nature, the 5 elements, Prithvi, Jal, Tej, Vayu, Akash, when you're close to them, the chirping of the sounds on a lovely spring morning, Vasant Ritu ki subah mein, if you are doing yoga practice or even your simple exercise, just feel the difference how you are. And this is how you can open your eyes. This is how you energize yourself. It's not necessary. This was a small synopsis of meditation. You don't need to go to Himalayas to do meditation. You can always just concentrate, see the breath going in like you're putting your pail in the well, and try to pull your breath out like you're pulling the pitch of water out of the well. Just feel that motion and concentrate yourself at the center of the eyebrows. You all practice yourself, and I think like how we do obesity practice, similarly I think diabetes also is a multidisciplinary management you need. You should have your trainers on call, you should have your yoga teachers on call, and it is an added advantage if you know people who are doctors and who are fitness trainers and who are even you have done course in yoga. That's a win-win situation. They can really handle well. So please, I mean, it's best to have some people like this in your team when you all are treating diabetes. So let's see. The list of benefits of exercise is endless. Improves your blood circulation, your cardiovascular endurance, your musculoskeletal health, and builds up immunity. So the last slide, sir, please. Role of exercise and yoga in management of diabetes clearly defines exercise and yoga has therapeutic, preventive and protective effects in type 2 diabetes by reducing stress, oxidative stress, and by improving the oxidant defense system. Therefore, exercise and yoga are being widely recommended as an important adjunct in management of diabetes, thereby keeping the symptoms in diabetes under control, protecting them from long-term complications, and improving quality of life in these individuals. So Soham, that Brahmand is within me. Shukriya, and I'm sure you like these pictures. Thank you for your silent hearing, and thank you very much, organizers. Thank you, Chairperson, for giving me those 2 minutes.